I think for many patients it's very frustrating to have that initial loss of 5% or 10% of their weight, which we consider to be clinically significant. And so if these drugs can play a small role for some patients to help them achieve some early success with losing weight, along with some lifestyle changes, maybe that gives them a stepping stone to move forward to make some long-term changes. Additionally, for some patients that are significantly obese, 300 plus pounds, body mass index is 35, 40, those individuals have a lot of difficulty performing physical activity. And from a cardiovascular heart health perspective, that's an issue. So clearly these drugs may help patients a little bit in terms of maybe dropping the weight down enough, and maybe that will allow them to do some exercise and become more active. The issue becomes when we have to consider stopping the medication, and then what happens? So does the weight go back up? And there is some data to suggest that if we stop the drug, that weight will go back up, especially in patients that don't make long-term lifestyle changes. No. Right now, none of the pharmacotherapy agents would be indicated in children. I don't foresee that approval being pursued, although I could be wrong. But clearly, I think in those individuals, it's much more effective and meaningful to help them make lifestyle change and to move the needle so that they don't become obese adults. Absolutely. I think particularly from the cardiovascular world's perspective, fen-phen was disastrous, and sibutramine, which was also taken off the market in 2010 due to increased risk of MI and stroke. So the history is just not great, and so if we can see some positive data in the next couple of years to at least show that they're safe in patients with heart disease, and maybe even more importantly, patients with heart failure. There's definitely a bit of a obesity paradox that we're seeing in heart failure. Some patients, when they lose weight, actually do worse. So there's so much that we have to understand, and I think in some ways these new agents are at least starting a conversation about the role of obesity in cardiovascular disease. For lorcaserin, for example, which is a serotonergic drug, it is specific for 5-HT2B, which is specifically found in the hypothalamus, whereas in the serotonin receptor that was on the heart valves, for fen-phen it was much more specific for that receptor, which increased the risk of valvulopathies, etc. So lorcaserin is much more selective for the receptor that's in the hypothalamus, so we think that that's an indication that it might be safer. I don't know that that's going to happen. I think ultimately to resolve this issue, it's going to be multiple population health initiatives and really getting people to modify their behaviors very early in life. I think there are two different questions here. One is how do we manage the immense population we have that's obese? The other is how do we prevent it? And I think that's where really the resources need to be in terms of our kids and really helping them make better decisions. There's also just a lot we have to learn in terms of the science. So clearly the brain, the central nervous system, and the gut communicate with each other. And we're just slowly, in the past 5 to 10 years, really beginning to understand what are those mechanisms. But of course, the more you dig, the more you understand that you don't know that much, and it just raises more questions.